Hi, this is Pat Dunn with a segment on checking your diabetes. Checking your diabetes includes checking your blood sugar, your hemoglobin A1C, your blood pressure, cholesterol and other lipids and lipoproteins, also checking your feet, your eyes, and your kidneys. So what do you need to check? Well, let's start with the alphabet. A is for A1C, or your hemoglobin A1C. B is for blood pressure. C is your cholesterol, and as we'll see, there's more to it than just your cholesterol. D is your diet. E is for eyes. F is your feet. G is glucose. H is your heredity. I is for immunizations. K are for ketones. And M is for microalbumin, which checks your kidney function. How do we check and diagnose diabetes? Well, a normal blood sugar is a fasting blood glucose of between 70 and 100. If you have diabetes, your fasting blood sugar or glucose typically will be greater than 126. And if your fasting blood sugar is between 100 and 125, you have what's called pre-diabetes or metabetes, or the metabolic syndrome. A1C, or hemoglobin A1C, provides an average blood sugar for the past 2 to 3 months. The recommended level is for the A1C to be below 7 for most people, and you should measure this every 90 days. You should always know what your hemoglobin A1C last result was. You should know what your target is, and you should also know when your next A1C is due. Next, we should check your blood pressure. Blood pressure measures the forces of blood inside your blood vessels. There are two numbers. The top number is the systolic pressure. The bottom number is your diastolic pressure. So the systolic is the pressure in your blood vessels when your heart contracts. And the diastolic, or bottom number, is the pressure when your heart is resting between beats. High blood pressure or hypertension can lead to heart attack, stroke, eye problems, and kidney disease. If you have diabetes, then blood pressure should be below 130/80. You should always know what your last blood pressure was and your last result. And common treatments for blood pressure include weight loss, a low sodium diet, avoiding stimulants such as caffeine and nicotine, relaxation, and medications. The common medications for blood pressure include ACE inhibitors, ARBs, beta blockers. When we talk about your cholesterol, we're really talking about a whole series of lipids and lipoproteins. Every time you eat, the fat in your food is wrapped in protein and sent to your blood in little vessels called lipoproteins. And of course you have LDL receptors, which take the LDL out of your blood and back to the liver. So when we have a lipid profile, you have cholesterol, which is the one of the forms of fat in your blood. The three important numbers to remember in your lipid profile are your HDL, LDL, and triglycerides. HDL is the good cholesterol, and it protects your heart. LDL is the bad cholesterol, and it clogs the blood vessels. And finally, triglycerides are fat in the blood that also increase your risk of heart disease and stroke. You should always know when your last cholesterol test or lipid profile was, and you should know what your HDL, LDL, and triglyceride results were. The recommended targets for diabetes are an LDL below 100, HDL above 50 in women and above 40 in men, and triglycerides below 150. Common treatments for cholesterol also include weight loss, a low-fat diet, a high-fiber diet, and more details on both of these in the feeding section. And the medicines that improve your cholesterol numbers are statins, niacin, fibrates, and resins. Does your inheritance include heart disease or diabetes? Diabetes and heart disease tend to run in families. In some cases, a genetic trait is passed down from generation to generation. In other cases, however, only bad habits are passed down. In either case, bad genes or bad habits, such as lack of exercise or poor nutrition, can cause diabetes. If you have bad genes, your risk factors may include high blood pressure, high LDL cholesterol, low HDL cholesterol, or small, dense LDL cholesterol. And if a parent has any of these, then each offspring has a 50-50 chance of developing the trait. Even if you did not inherit bad genes, you may have inherited bad habits, and these may include lack of exercise or physical activity, cigarette smoking, a high-fat diet, a low-fiber intake, or high levels of stress. Diabetes is something you work with your doctor on. You're working with him as a team. You should always talk to your doctor and have an appointment every 3 to 6 months. You should always check your hemoglobin A1C, and the recommended level is to be below 7. Also, every year you should have your glucose, blood pressure, cholesterol, microalbumin checked, as well as an eye exam, a foot exam, and a flu shot. So what are the keys to checking your diabetes? It's monitoring your blood sugar and hemoglobin A1C. It's monitoring your risk factors, such as your blood pressure and your cholesterol. And it's working with your doctor to make sure that you're monitoring your eye health, your feet health, and making sure that you're not at risk for pneumonia and influenza. Our next section will be on healing your diabetes. In the healing section, we'll discuss understanding your blood sugar and what to do if your blood sugar is too high or if your blood sugar is too low. Understanding insulin, and if you're on an insulin pump, understanding how the pump works. We'll discuss oral diabetes medications, and then finally energy balance.